Hello everybody. Today we conclude the course on medical robotics, discussing future trends in the field. What are they? We talk about human-robot collaboration, AI in healthcare, and data security and ethics. So let's explore one of the most transformative aspects of modern surgery, human-robot collaboration, HRC. As we see in the figure, there are three distinct modes of interaction between surgeons and robotic systems, each representing a different level of autonomy. The visualization captures the evolution of robotic surgery and the dynamic relation between human expertise and machine precision. We have the first, teleoperation robotic assistance, level of autonomy 1 to 2. This represents the most widely used approach in robotic surgery today. The surgeon has full control, using a master-slave teleoperation system to guide the robotic system instrument with precision and dexterity. The prime example is the Da Vinci surgical system, which you might have already heard about in the course, where the surgeon sits at a console and manipulates robotic arms to replicate their movement with greater stability and accuracy. Despite the benefits, this mode has limitations. The robot merely executes command and lacks situational awareness. This can create challenges in force perception, for example, making it difficult for surgeons to gauge pressure applied on tissues, especially in delicate procedures like suturing. Efforts to enhance this mode include haptic feedback system, which restore the sense of touch by providing force feedback to the surgeon. So we then achieve the autonomous execution of subtasks, level autonomy 3. We see a shift toward robot autonomy. Instead of relying entirely on a human surgeon, the robot can now perform specific subtasks independently, such as suturing, cutting, and instrument positioning. The mode significantly reduces the cognitive and physical burden of the surgeon, for example in appendectomies. A robot can execute pre-planned movement based on real-time imaging, while the surgeon supervises and adjusts parameters as needed. The biggest challenge in this mode is environmental perception. The robot relies heavily on computer vision and real-time 3D reconstruction to navigate the complex dynamic anatomy of a patient. While promising, current robotic systems still struggle with limited field of view and real-time processing constraints, making this an area of active research. So then we reach collaborative decision making, which is the most advanced mode of human-robot collaboration, where humans and robots collaborate in the decision-making step. Here, the robot doesn't just follow instruction, it actively participates in planning and executing tasks based on its perception and predictive modeling. In this mode, the surgeon and robot share control dynamically. The robot can suggest optimal movement, adjust grip force, and even anticipate the next steps of surgery. One of the most exciting developments in this field is the integration of AI-driven reinforcement learning, where robots analyze past surgeries to refine their performance over time. Despite its potential, this mode raises ethical and safety concerns. For instance, who is responsible if an autonomous decision leads to a surgical error? Moreover, trust between surgeon and robots must be carefully managed to ensure adoption in real-world operating rooms. Let's now talk about AI in healthcare, especially the classification, since AI is currently revolutionizing healthcare, offering new tools that enhance diagnosis, treatment, and patient care. But here we provide a simple classification of AI, and we provide a spectrum between virtual and physical AI. So we have virtual, which is on the left hand of the spectrum, is completely software based, while physical is completely, let's say, physical based. And we have hybrid systems in between, and we have some examples. So clinical decision support systems on the software side, social robots, micro robots in between, and finally the telerobots for surgery on physical devices. And we have enabling technologies tying between the two. So it's sensors, wearable sensors, medical images, data in general. And on the other side, we have artificial intelligence, algorithm, virtual reality, augmented reality, visualization, and data. Now let's talk about some example realization of AI in healthcare. So AI in healthcare is not just a concept, it is a reality transforming patient outcomes at the moment, from diagnosing diseases to assisting in surgeries. AI is actively reshaping medicine. Let's talk about first AI in early disease detection. So AI has shown remarkable potential in early disease detection, helping doctors diagnose conditions faster and more accurately. One example is sepsis prediction. AI system analyzes patient data to detect sepsis hours before traditional methods, potentially saving thousands of lives, which is very important as sepsis is one of the biggest causes of death and it's very hard to detect because of the symptoms that it provides. Tumor detection and ICU monitoring. AI-driven image analysis improve early cancer detection by identifying suspicious lesions in the medical scans with higher accuracy than human radiologists. So this is already well known. And in ICU monitoring, very similarly, you can fuse different streams of data very efficiently, as often it is the medical professionals are overwhelmed by all the signals that come in the intensive care unit. Then we have an interesting case of COVID-19 detection. So using AI-powered tools that can detect COVID-19 symptoms from chest x-rays and even analyze the patient's cough sound to identify a potential infection. And then we have other cases such as using patients triage, so using to handle the flow of patients and identify the severity of a patient's condition early on, even without needing the use or the employment of humans to do such tasks. Then we have cardiovascular risk prediction, which is very interesting as there have been some correlation between retina scans and cardiovascular risk. So through AI, there's been some ties that allow to using retina images to define if there might be some cardiovascular risk down the line. Then there is gait analysis, which is part of AI in patient monitoring and rehabilitation. So that would allow to monitor patients more efficiently and understand first their status of rehabilitation and also if they're developing some symptoms, or for example it's an early onset of some condition such as Parkinson's disease. And then there is home care robots, so AI powered social robots which might assist elderly patients by providing companionship and medication. And then we have biomechatronics, which is a field that is in between biology, robotics, and mechatronics, and it's used to create very small robots that are able to enter the human body and so perform some precision medicine or other kind of possible tasks in the future. And AI is being used to construct these kind of robots. Now, while AI has very big potential in healthcare, its adoption is not without challenges. So we have issues related to trust, security, ethics, and data quality, which must be addressed before AI can fully integrate into clinical practice. We have some challenges here: resistance to technology. One of the biggest barriers to AI adoption is the reluctance of healthcare professionals to trust AI-driven systems, and also the patients do not really struggle to trust some of these systems. Doctors and nurses fear AI, lack of AI training, and to overcome it, AI should be viewed as a tool to enhance and not to replace human expertise. Then transparency and explainability. AI systems often function as black boxes, meaning their decision-making process is difficult to interpret, as we see in the picture on the left. If an AI system misdiagnoses a patient, doctors need to understand why, but the lack of transparency makes it difficult to trust this AI-generated recommendation. And at the same time, it becomes very difficult to handle responsibility, accountability, and liability of whenever an error or mistake is made. And we have data protection and security. So who owns the patient's data, who is able to access it, and what are the cybersecurity risks. And then we have data quality and integration. Of course, the quality of the data is very significant and has a large effect on the quality of the outcome of AI models. And again, safety and security tied to this topic, as we need models which can prove to be safe and secure and have some not only layer of security but also measurement and guarantee of security. And finally, we have bias. So there are some medical conditions which have been shown to be characteristic to some minorities, for example, and if a minority is misrepresented in the training set of an AI, it could lack the presence in the or could lead to misdiagnosis or missing symptoms, which need to rely on the knowledge of the minority from which the patient comes from. And now we briefly talk about data security and ethics. So the integration of artificial intelligence and robotics in healthcare represents one of the most profound technological revolutions of our time, or it would. And these innovations promise faster diagnosis, more precise surgeries, and enhanced patient care. However, the ethical responsibility and the security aspect is still a big if, and is still a big struggle. So AI and robotics demonstrated they have potential to affect the healthcare system with automated diagnostics and robot-assisted surgeries, as we have seen before, but there is some ethical concerns about privacy, data security, as AI system relies on vast amount of patient data, raising concern about privacy, hacking, data misuse, and healthcare institutions must ensure robust data encryption and data protection in order to maintain the patient trust. And then, as we talked about before, bias and fairness in AI, which is a pressing concern. In the algorithmic bias based on where AI models are trained and using non-representative dataset, we can lead to disparities in healthcare outcomes. And moreover, we said before, accountability and transparency. When AI-powered systems make a critical healthcare decision, who is going to be responsible in the case of negative outcomes, let's say, between the manufacturer, the training data, the hospital, the medical personnel. So establishing clear accountability and transparent AI decision making is essential and is still a big problem. And autonomy and human oversight. So while AI can assist in decision making, final control must remain within human healthcare providers in order to maintain structure that we have today. And then we have regulatory challenges, as it is very difficult to put in place a system of laws in general in healthcare, and especially when it comes to this kind of systems of AI. Ethical AI adoption must ensure equitable access to advanced healthcare, avoiding a digital divide where only wealthy institutions benefit from cutting-edge technology. And global regulatory frameworks must evolve to address liability, intellectual property, and patient rights in AI-driven healthcare. So finally, we present some roads, some ways to address these issues. We have the implementation of strong data security protocols, so encrypted data storage, anonymization techniques, and decentralized data sharing models which protect patient privacy. Then eliminating algorithmic bias, so training AI on diverse and representative dataset, and continuously monitoring system performance, which mitigates bias and promotes fairness. Enhancing transparency, so AI decision making should be explainable, allowing healthcare providers and patients to understand the reasoning behind recommendations. Then we have establishing a regulatory framework, so international guidelines should address AI liability, patient consent, and human oversight to ensure ethical implementation. And finally, fostering collaboration between AI and medical professionals. Instead of replacing doctor, AI should serve as a tool to support medical decision making, improving efficiency and precision without eliminating the need for human expertise.